Salam alaikum. Now I would like to discuss about VP shunt. What is VP shunt? VP means ventriculoperitoneal shunt. This is the picture of VP shunt. For knowing the VP shunt, actually, if there is hydrocephalus, for managing those type of patient, we actually do VP shunt in children. We know that CSF is formed by the lateral ventricle. CSF is formed by the choroid plexus of the lateral ventricle. From lateral ventricle, the CSF enters into the third ventricle through foramen of Monroe. From third ventricle to CSF goes to the fourth ventricle via aqueduct of Sylvius or cerebral aqueduct. From fourth ventricle, it goes of laterally via foramen of Lashka and medially via foramen of Magendie, that it enters. Then this CSF is drained in the subarachnoid space, and then it reabsorbs in the arachnoid villi and arachnoid granulations. This is the ventricle, and from this ventricle there is a valve. This is the subcutaneous catheter, and this CSF actually drains in this peritoneal cavity. If there is shunt anomaly or any sort of complication, how we can approach? If there is raised intracranial pressure, how we can know this raised ICP, or by seeing if there is headache, vomiting, or lethargy, if there is any vocal neurological deficit or fever, or if there is abdominal pain. That means if there is peritonitis. So, four things: raised ICP, vocal neurological deficit, fever, and pain, abdominal pain. Then what should we do? We should do shunt series. That means we should do X-ray, and we can do CT scan. For neuroimaging, we can do CT scan. And if there is abdominal pain, localized abdominal pain, and then we should do abdominal ultrasound. So if there is raised ICP or any focal neurological deficit, we do CTs, and if there is pain in the abdomen, then we should do abdominal ultrasound. If it is abnormal, that means three things happen. There may be shunt discontinuity, there may be abdominal cyst, or there may be hydrocephalus. Then what should we do next? We should do CSF shunt tap. We should do CSF shunt tap. And if there is obstruction, or if there is infection, if the shunt series or abdominal ultrasound or neuroimaging is normal, then recently placed shunt increased risk of ventriculitis in first 6 months. Persistent fever without a source? No. Then evaluate for alternate cause, not these VP shunt anomaly. If the these three shunt series, abdominal ultrasound, neuroimaging is abnormal, then three things you should look for: shunt discontinuity, abdominal cyst, and hydrocephalus. Then you should do what? CSF shunt tap. If there is obstruction, replace the shunt. How you can assess the obstruction? There is increased pressure or no flow, then increase, then replace shunt. And if there is infection, that means increase cell counts plus culture and remove or externalize shunt, start IV antibiotic. And that's all about this. Hope you enjoyed.